Welcome back, everybody, to our Stroke Group Network Conference 2023. My name is Beth, and I am the Group Networks Manager at the Stroke Association and chair of this wonderful event. Our next session is around understanding health inequalities and why this matters to stroke groups. I'm really excited for this session as we're going to hear from a range of experts who will share their experiences and perspectives with you. First off, you'll hear from Sophie, who is our communities lead at the Stroke Association. Then you'll hear from Madura, a health inequalities specialist. She ran a programme in Greater Manchester, and she'll share some of her experiences on why people may not be able to access support. You'll hear from Julie, who's a wonderful group volunteer and group leader at Forward Strokes in Leicester. And she will share some of her tips on how she supports people from across diverse communities. Then you'll hear from Mary, who is a volunteer and a group member in a group supporting people affected by stroke, predominantly from a Black and Asian community. And then Donna, who is our engagement lead for the North East and Yorkshire. She will share her experiences of building partnerships with local community organisations. So it's a jam-packed 55 minutes, so we'll get straight into it. And I will introduce Sophie, our communities lead, to start us off.
Hello, good morning everyone. Hope you can all hear me okay. As Beth said, I'm Sophie. I'm communities lead at the Stroke Association. And I'm going to talk to you about what the phrase health inequalities means, to give some background and context, and to take a brief look at what it means for stroke and what we can do as an organisation and as groups to tackle health inequalities. So could I have my first slide, please? Thank you. So health inequalities are avoidable, unfair, and systemic differences in the physical and mental health between different groups of people. When we say systemic, we mean affecting every part of the health and social care system. Next slide, please. Now, these differences divide into 4 closely linked areas: how well off we are, so our level of education, income, or the job we do; who we are, including any characteristics protected in law, such as sex, ethnicity, and disability; where we live in the UK, which region, whether we live in a city, the countryside, or by the sea; and those who are vulnerable, for example, people who are homeless, migrants and asylum seekers, and travellers. All of these differences in where we live, who we are, and our environment combine to lead to the differences that affect our health, how we access support, and how long we live. Next slide, please. Thank you. So when it comes to stroke, we know that some groups of people are more likely to experience stroke, but not everyone has access to prevention, treatment, and rehabilitation support. An example of this might be what we can do to reduce our risk of stroke, or what services are available to support us if we have a stroke. So if we take risk factors, we know that there's a number of risk factors for stroke. Some we might be able to change and some we might not. And some people won't be able to make changes as easily as other people. This might be because of a disability, of low income, if we have someone to support us to make those changes, caring for others, mental health, living on the street, or being an asylum seeker or migrant. And what services are available to support us if we have a stroke may be affected by where we live, because not all services are available in the same way across the UK or to people equally. So ambulances might take longer to arrive when called in one area than another, whether we know about the services available to us or not, because information is only available on the internet or in English. Or community transport might not be available, which can make it difficult for some people to attend services. Next slide, please. So what can we do about this? As you heard from Juliet yesterday, or you may have heard in the talk, we are committed to working towards a fairer future for all. So every person affected by stroke can achieve the best outcomes, and for anyone affected by stroke to have access to treatment and support. In this, at the Stroke Association, we are guided by our approach called Solving Inequity in Stroke, and we want to make sure addressing barriers for people in accessing support runs through all of our work. We will do this by improving our services, including our support offers, and influencing changes to the healthcare system. And we will work with diverse communities to shape our work. We will form equitable partnerships, and this means working with others where there is trust, respect, and benefit for both parties, and also challenging those who don't share our commitments. We will build trust and credibility, learning from the experiences and needs of people affected by stroke through meaningful involvement, and we will develop our people and leadership to build an inclusive workplace. Next slide, please. Thank you. So it was a brief overview, but as you can see, health inequalities are really big and complex. We can't tackle everything at once, and it will take time to see whether we're making a difference, but we can all take steps to tackle them in the work that we do. And we know that groups have wonderful ways of welcoming new members and reaching out to their community. But what more can we do? We hope that the presentations that you'll hear from the following speakers will help you celebrate what you're already doing and inspire you to think about what else, however big or small, you could do to make even more of a difference. So to start, we have Madura talking about a project in Manchester where she learned more about those who don't access services and why.
Hello everyone, my name is Madhura. Some of you may know me since I worked in the Northwest Engagement team at the Stroke Association for a couple of years. And more recently, I've left that role and moved from Manchester to Newcastle to study speech therapy, which is my passion. Now, when I was working here, I had the chance to lead a very interesting pilot project in Greater Manchester, where we tried learning more about who doesn't access support services after a stroke and why. Now, the aim was really to learn about stroke survivors and carers' personal experiences of accessing support. And this project gave us a lot of learning about the impact of what we call health inequalities. It's important for us to remember that, by definition, health inequalities are unfair. They're avoidable differences in health between different groups in society. And these differences spring from who someone is. So this could be where they live, their income, their first language, religion, ethnicity, gender, sexual orientation, to name a few. We also know that there are some communities that do not receive adequate support after stroke in particular. This could mean someone who comes from a lower socioeconomic background, someone who is a first-generation immigrant, perhaps someone with a physical or mental disability, or someone from a minority religious community. The health system does have to do a lot to improve and make sure that all of these people have access to the support that they have the right to. But in the next 5 minutes, I'm going to talk a little bit about what this means for groups and volunteers such as yourselves. To understand how your group could truly make a difference, we need to start by looking at a few buzzwords and breaking them down. In our society, there are many forms of oppression. You may be familiar with terms like racism, sexism, ageism, etc. There are different kinds of discrimination. But more than often, there is more than one of these in a person's life. So for example, while a white, young, middle-class woman's career might improve quite a bit with gender equality laws in place, an older, Black, disabled lesbian would continue to face barriers due to other parts of their identity. Which brings me to this term, intersectionality. It was coined by a scholar, Kimberly Crenshaw, during the Black feminist movement. And it's essentially about understanding all of these different aspects of a person's identity, and as a consequence, all of the potential barriers to their well-being. It's about understanding that different combinations of oppression lead to different experiences. Now, each one of us has many parts to our identity. For example, I am a student now, but I'm also many other things. I identify as a woman. I am Indian. I come from a middle-class background. I have an anxiety disorder, which is a long-term mental health condition. I'm queer. I speak English. My mother tongue or first language is Tamil. I'm not religious. And as you can see, in some parts of my identity, I have privilege, such as the fact that I speak English fluently and live in the UK. It makes life easier for me. However, other parts of my identity, such as being queer, being brown, being a woman, result in me facing more barriers in my daily life. And these may also potentially impact my access to healthcare, is what research shows. The project I conducted gave us a lot of learning that can help improve our health systems. So, for example, stroke survivors told us that we need to get better at accurately recording and sharing their ethnic background and their preferred language in particular to make sure that they get information about their stroke in a language that they're comfortable with. Health professionals need to have better cultural understanding of the local population that they work with. Carers and stroke survivors both told us that we need clearer information in hospitals post-stroke, better signposting, especially when it comes to mental health. What we mean when we say inclusion is feeling that we belong at the base. And unfortunately, we know that for many people, this is not the case. So why is it important for support groups to be inclusive? Well, to put it simply, it matters so that every stroke survivor feels like they belong and that they're welcome in support groups. It is important to remember that just by saying we're open to everyone or we welcome everyone, we're not being inclusive. For example, a support group may have excellent volunteers who are very kind to all of the members. They may be offering free transport for members who need it and be located in a very accessible venue. But for instance, if a stroke survivor comes from a low-income background and cares for 2 children, they may not be able to attend this group because they need to be at work instead. Or let's say someone comes from a minority religious or ethnic background. It may feel very intimidating for them to walk into a room where nobody else looks like them or speaks like them. And there are many other reasons why someone may not attend their group, whether they don't choose to do it or whether they don't feel able to do it. And it's not practical to aim for perfection, we know that. It is hard to undo barriers that have been built up over generations. But there are many things that you can do to make your group more accessible, more inclusive. Remember, inclusion is about understanding different perspectives and changing our own mindsets to understand other people's experiences, especially when they're different from our own. So what can groups do to be truly embedded in their community? Well, one way to do this is to start by understanding your community better. Think about that image we looked at about intersectionality, and perhaps you could try and identify communities within some of those categories that live in your area. Now, these people may not be a part of your daily lives, which is okay. And that is why the next step would be to identify how to reach them. How do you tell them that your group exists and what you can do for them after stroke? One way of doing this would be finding out where these communities meet and connect with each other. What are their safe spaces? This could be religious places such as temples, churches, and mosques. It could be community spaces such as libraries, or even your own local supermarket. The second thing you could do is learning, listening, and partnering. Now, this means accepting that we don't know what we don't know. It means accepting that our dominant culture tends to be white, able-bodied, middle-class, cisgendered, and straight. And not everyone fits into these categories. So the more we interact with people who are different from us, the more we're going to learn how to make groups inclusive for these communities. We are far from being perfect, but we can be committed to growing. Learning how to be inclusive and accessible is going to be a long journey, and there's going to be a lot of challenges along the way. So do make sure that you share your learning with each other as you go along. I'm quite positive that we can get there together, one determined step at a time. On my last slide, there are links to some references that I've used. The YouTube videos are quite useful and very easy to follow as well. I do hope that you find them useful. Thank you so much for your time.
Thank you, Madhura. Some really interesting information and food for thought there, and some great practical tips there at the end for us to think about. I just wanted to mention the slides will be available in the resources following the talk, and we do have a definitions document which covers some of the terminology that I introduced at the start of the session today, so you'll be able to refer back to those. But now I wanted to introduce Julie from Forward Strokes Leicester, and what their group does. She's going to be talking about what their group does to be inclusive and accessible. Hey Julie, we're really excited to have you here today to talk to you about diversity and inclusion in your group. So do you want to give a bit of an introduction to yourself and to your group, please?
Hi, thank you for inviting me along. My name is Julie, and I'm a 3-time stroke survivor, and I'm also the chairperson, which I've been for 16 years, at Forward Strokes Leicester, which is a stroke association voluntary support group, and we're based in Leicestershire.
Lovely, thank you. And could you tell us a bit about how you include people from diverse backgrounds and communities in your group?
Yes, when any member attends our group, regardless of their background, I like to feel that they're made welcome and included at group, and this begins from day one when they first attend their meeting. I first introduce myself, and at Forward Strokes Leicester we have what we call a buddy system, and this is where a new member is paired with a long-standing group member, so they're made to feel relaxed and welcome at group. In Leicester, we are a city where we have a lot of different cultures of ethnicity and population. So at group, we can use our buddy system to make people from other backgrounds feel very welcome. What we do is we use the buddy system here in the same way. If a member comes into group where English isn't their first language, we can often find that we have a member at group who can help that new member possibly use the long-standing member to help to translate, so that the new member can be made to feel more welcome and comfortable at the group. Also, what I do at group is to any new member where English isn't their first language, I make sure that I explain to them that the Stroke Association does have a wide range of literature, information leaflets available, and where they can obtain this information from.
Thanks, Julie. It's really great to see how you're welcoming people into the group. How do you feel the group is for the members? So how do they feel about the group? And do you do anything that encourages and supports them to stay?
People from other backgrounds often feel that the group is for them, I think, because of the atmosphere that they feel and pick up from our members at the meetings. I think our group meetings are relaxed, friendly, and inclusive for all. I don't really do anything out of the way to encourage people to stay, but I at every meeting I do go around and speak to all the members in person and ask if they are okay, no matter what their ethnicity is. And I think that if a member can see this, it makes a difference. I don't know if maybe on a first meeting, if a member sees this, then it may make a difference, because regardless of how many years a person's been coming to group, if a new member sees that I'm going around and asking a member if they are okay, they may think, well, this group cares about their members. I don't know, it's just something that I've always done. We are just a caring and friendly group. And I'd always tell the members at the group that Forward Strokes Leicester is their group. It's not a group that's run by the chairperson and the volunteers. The group is their group. It's for them, and whatever they want to do, it is their group. And I think a new member coming into the group And I say that at every group meeting, you know, they want to bring ideas forward for what the group wants to do. It's not the people that are running the group, it is their group. And a new person seeing that, may think that, you know, that this is the group that I want to be in.
Brilliant. That sounds amazing. We've talked about so far how you incorporate people from different backgrounds, different people who don't speak English as a first language, and how you try and build confidence in group members to have their say in the group. I did want to talk a bit about disabilities and communication. So we know that some stroke survivors struggle with access to care because of their disabilities. So how does your group make people with communication difficulties and disabilities feel welcome?
Forward Strokes Leicester makes sure that our group is inclusive for all of its members. Our venue is suitable for all. Obviously, when we were looking for a venue, we made sure that the building was accessible for everybody. I myself am a wheelchair user, and I know how difficult accessibility can be at times. Any outings that we go out on, and any suggestions given by group members are made sure that accessibility is inclusive to all before that they are obviously taken up. Whenever we go out on a coach, we use the same coach company, and the coach is fully risk assessed. The coach has a lift, which means that all members can be included on our day trips. Regarding communication, for those members who have aphasia at group, I know how difficult this can be because I do have personal experience myself. So I can empathise with members also. We do have the Stroke Association communication aids that members can use when they join the group. And also when the new member joins the group, I have an initial chat with them also to make them feel that there is support there. And what we do is we use the buddy system as well. So if a member is struggling when they come to group with aphasia, I speak to them myself and say that if they would like some additional support, with some help with communication, then we can pair them up with either myself or another volunteer if they would like some support. Some people struggle, and if they would like some support, then we can pair them up with somebody. They just need to speak to myself, and I will do that for them. So regardless of communication or physical disability, I would like to think that at Forward Strokes Leicester, our group makes sure that all of its members are welcome and most of all included in all that we do during all of our group meetings.
Thank you, Julie. So it was really great hearing from you about the approaches that you take at your group, and hopefully some of the things you mentioned resonated with our audience today. One thing that has come up in the chat was around if anyone has people in their group who are struggling with language difficulties. We do have some fact sheets available in various different languages, but it's not exhaustive, but it is available. They are available. We can get the link to the website in the chat. We also do have access to use Language is Everything, which is a translation line, which we can get the details put in the chat as well. So next, I'm delighted to welcome Mary from our BAME group, who will be speaking to us live now about her group and why it's important to her. So welcome, Mary. Hello. Would you introduce yourself and the online group that you are part of?
Hello, Sophie. It's good to see you.
You too.
I've been looking forward to today, actually. I've been preparing very hard for it. My name is Mary Magdalene Sego. I had stroke very many years ago, actually, 2007, about 16 years ago. And I was actually working when it happened, but the care I had when I had the stroke was excellent. And when I retired, I thought of giving back a bit of my time by volunteering with the Stroke Association. And I joined a voluntary group where we did blood pressure in the community. We used to go to libraries and supermarkets to check people's blood pressure, since blood pressure is one of the main signs. And I joined BAME group, which is Black and Asian Minority Ethnic Minority Group. That was during the COVID time. And that's how I came to join BAME group.
Thank you. And why is this group important to you?
Seeing my own people allay anxiety like anybody else, but we are a mixed group, actually. It doesn't have to be just Black and Asian, because ideas about stroke is actually, I think it goes across the board. So we welcome anybody to join, but mainly encourage Black and Asian people who have different cultures, different background to join and feel comfortable. And it has benefited me because I'm able to share my cultural background with other group members.
Fabulous. Is there anything you want to say more on how it's helped you or others in the group?
Yes, we have been exchanging ideas about how Black people or Black and Asian minority group. I will use the terminology BAME from now on because I wanted to explain what BAME means. So the BAME group, actually, when people are discharged from hospital, sometimes they don't know how to access some of these services. But when I heard about, I never joined the BAME group because I didn't need to. It wasn't there when I had mine. So when it came along, I thought, let me join them in order for me, myself, to be a resource to talk to people of my kind. And when we meet up, we just open up and chat about our own personal encounters or needs. And things like the food we eat, the type of food we eat, and how we cook. So we exchange because our food may be contributing to our blood pressure suffering. The cultural background, obviously, coming from diverse areas, my particular area may be different from like an Asian person. So the Asian person tells me what they eat and how they cook. Then I tell them how we manage ours. So this is just an example, and also cultural beliefs and religious beliefs as well. We just exchange, and yes.
Lovely, that's great, thank you. What would you say to group volunteers who want to welcome anyone from Black, Asian or minority ethnic groups into their group? Do you have any tips on reaching out and letting them know that the group is there for them?
When was it what's her name? Madura touched on a lot of things. And yesterday, when Juliet was also talking, mentioned a lot of things that I think the Stroke Association is actually there for people, for everybody, and they are reaching out for everybody that suffers stroke. Now, for any minority group, the best thing is just a warm welcome. That warm welcome, and Julie, actually, the last book said, I admire her way of handling or working with people from diversity. So that warm welcome actually embraces anybody that join. And then just educate them about the services on offer, because when we meet at BAME group, that's another thing that we touch on. And then we respect each other's view, because stroke people have all stroke sufferers or people who have suffered stroke in the past, they all have different symptoms, and what touches them may not touch another person in terms of either a slow speech or coordinating their words, and try to be open and open to them, so that they will know that the facts of suffering stroke. Encourage members and to befriend each other, because if they are not attending meetings, for instance, get any member to befriend them. And if, especially, I'm talking about areas whereby it's predominantly white people, and maybe somebody comes along from Asian background or the minority, the BAME people. And the last thing I wrote was, stroke changes people. People behave differently when they have stroke, and certain characteristics that they did not exhibit while before stroke, all of a sudden they do. So understanding them is very, very important. And the word I used was swear words. Some people never swear before or swore before, and all of a sudden they start swearing, and then you will think, oops, where did that come from? Could be. I'm not saying it covers everybody. And so mood changes also contribute a lot. So that is what the tips I have actually. What I need to do is just to encourage group members to actually refer people to the BAME group, because once they do that, when they come to meet us, they are so happy and say, oh, I didn't know this group exists. So we need a lot of advert on that, because not many people attend our group. And we meet on once a month on Zoom, by the way. We meet on Zoom, and once a month on fourth Tuesday of every month. And from 11 o'clock, we aim at using just 1 hour, but sometimes we go over a bit. And at the moment, Joy is the lady that helps us to meet on Zoom.
Lovely, that's great. Thank you so much, Mary. There's some really brilliant insights there, and it was really great to hear you reflecting that some of the tips that you had for people out there, things that you heard Juliet speaking about or Julie speaking about, and Madura as well. So it seems like everyone is of the same mindset of how to welcome people and to ensure that we're reaching out to people from diverse backgrounds. So thank you so much for your time today. Will you be in the connecting chat session after this for people to reach out?
Yes, I would want to, yes, please.
Lovely. So hopefully we can, if you have any questions for Mary, she'll be in the Q&A at the end of this, but also in the connecting session following this. So thanks, Mary, for your time today.
Thank you, Sophie.
Thank you. And now finally, our last speaker of this session, I'm going to hand you over to Donna, who is going to share some of her learnings about working in partnership with community organisations.
Good morning, everybody. So I've been with Stroke Association over 20 years now. So I've worked in quite a few projects, and a lot of those have been particularly the second decade that I've worked for the Stroke Association, have been very much about working in the communities and building relationships with communities and how they can benefit the stroke survivor if we're working together. We've made some mistakes along the way where we've thought we know what this community needs, as opposed to actually asking them, what do you need? What would benefit you in this area? How best can we support any work that you're doing? And in return, then, how can they support the work that we want to achieve? We've understood very clearly that in order to start that relationship in a community, you need to find a trusted partner. And by that, I mean somebody that's already embedded in the community, that the community have trust and confidence in. Go speak to them, understand what their needs are, understand the structure. Are there any major cultural barriers that may be stopping people from their community coming along to your group or working with us as a charity? So it's really about understanding what they need and then how we can work with them. What can we add value to these trusted partners that are in the community? How can we build on what they're already doing? It really is about going into each community individually and understanding what their needs are and what their aims are. Are they aligned with what we want to do as an organisation? And are they aligned with what you want to achieve as a group in your local community? From a group perspective, it's understanding maybe what someone's barrier or challenge might be to get in that group, and if there's a communication barrier there, then again, this trusted partner, building that relationship with them could be a way to understand what compromises might need to be made, what issues they might need to overcome. Because as I think somebody had already put in the chat, it can be difficult if somebody has a language barrier and then also has a communication difficulty such as aphasia. So it's about, we're not best placed to tackle the language, but we are best placed to tackle the communication. So working together with somebody who does understand that language barrier is really the best place to start to help that person. It's also about looking at the resources that these trusted partners might be able to give us and share with us, so that there's a local resource there. So becoming that person in the community that they feel they can trust us. They may refer people into the groups, which would be great. They may support them to access the groups, which can also be great. And they can also give you an understanding of maybe what that person needs to feel comfortable and welcomed into that group. And this can be anything. I mean, we spoke about language. I spoke about language today, but it can also be culture. It can also be religion and beliefs. And it's about making that introduction to the group and that person to feel comfortable, so that you're giving a complete, accessible, open and welcome to that person, so that they can then get that peer support that the groups provide so well. I don't really have that much more to say on this. I'm sure we'll have lots of questions in the Q&A, but it really is about building those relationships, finding out who's in your community. A great place to start with that is to look at, is there any local community centres that's specifically working with a group of people? How can they, sort of support? What do they see as the needs in the community, so that people that they're supporting who perhaps need that stroke peer support can access your groups and actually then take forward the support that you can offer and not feel like it's a challenge or a barrier, so they end up missing out and they're not able to get that valuable support from yourselves. Yep, that's it from me. Sophie, back to you.
Thank you. Back to me in the studio. I feel like I'm on GMTV. Is that still a thing? So thank you, Donna. It's really great to hear those tips, and I think it overlaps with some of the things that we've heard from others. And so that brings, I suppose, the presentation element of this this session to a close. But I just wanted to pull out that across the work that all of our speakers have spoken about today, we're already seeing that the work that we committed to, that I introduced at the start, in tackling health inequalities, is being addressed. It's happening. It's out there. Involving people who are affected by stroke, working with diverse communities, building equitable partnerships, and that trust and respect, and using learning from all of these to improve our support offer. And we know there'll be so many more examples of that across the network with you out in groups. So a big thank you. And now I'll hand back over to Beth.
Thanks, Sophie. Thanks to all of our speakers. Wow, that was jam-packed, but it was absolutely fantastic at a really great pace as well. I want to say a huge thank you to Sophie, Madura, Julie, Donna for all of their experiences and perspectives, and really helping us to think how we can support people better. I am going to ask Anne to join back in to give us a little reflection on how things are feeling with you in the conference.
Thank you, Beth. Yes, we've had lots of nice comments and things coming in. Just going back to the start of the day, people really appreciated Doug's wake up morning energizer this morning. Lots of nice comments about that. Doug's recording of that session will be available in the talk area, along with the other the Move to Your Mood sessions that he also referred to, so you can check those out afterwards. In regards to this session, a big thanks to all our speakers for this session, for giving a clear and an informative session, and very good explanation of intersectionality. Gemma mentions that her groups run their group meetings in Tesco's, and she says that really helps with being inclusive and visible in her local community. Tracy Grant Smith agreed with Julie Monk's point about members should really be included in what the group does and how it operates. And Laurie from Nailsea Stroke Club has praised Mary for her talk just now, and really good to hear the wider view of involving Black, Asian and minority ethnics. She acknowledges that she's not sure that they've done a lot in the Southwest to reach out to these groups, but it's something that she's grateful that it's been brought to people's minds and that they can work on going forward. So lots of thanks to Mary, and lots of interest in your group, Mary, so you might be inundated with some new members from the South Yorkshire area and South East. One of our colleagues has posted the details of your group in there. And empathy in your swearing example, Mary, there's a few people have acknowledged that they recognise that in their own groups or in themselves. So thank you for pointing that out.
Amazing.
But
Thanks,
please do keep posting your questions, and we'll put those to our speakers shortly. It's obviously a hot topic, so keep posting.
Amazing. Wonderful summary. Thank you, Anne. And thanks everyone for continuing to engage in the session. It really brings it alive when you're engaging in that chat box and asking questions and using the contact us button if that is easier for you. So we have around 10 minutes, 8 minutes left before we break for coffee and a break away from the screens for a little bit. So I would like to bring back Sophie, Donna and Mary for a Q&A. Hello. Fantastic. I've got a few questions lined up, so I might come to Sophie first if that's all right, because we've had a question that is asking, are all our materials easy read?
So Easy Read is a very specific format, and we don't produce Easy Read, but we do have some resources that are aphasia friendly, which have the same benefit as Easy Read. We've done lots of testing with stroke survivors in the past, and aphasia friendly is preferred to Easy Read for our stroke audience. So that's.
Thank you. Yeah, that's a great answer. Great question as well. Thank you so much. Mary, lots of love for the group. Yeah, in the audience. Tracy has said, lovely to hear from you, Mary. Can we recommend your group, your online group, to people in the East region? So are you able to take people from outside of London? Do people join?
I'm not sure about that, because I think that control comes from Stroke Association and how they've allocated. So Joy might able to throw some light. In other words, get in touch with Stroke Association. Maybe Beth yourself or Sophie can help that person. If our group, as far as I think they can. It's on Zoom. We are on Zoom. So who cannot join? Zoom can cater for everybody.
Yeah.
And I'm looking forward to people coming from
Fantastic.
That would be exciting. Yes.
Yeah. Fantastic. I think that would be great. Yeah, if we can send those details. So I think Velma, one of our engagement officers, has sent the details of the group. So hopefully some more people can connect with you, which would be lovely. Fantastic. Yeah. Thank you. There's been a really interesting question from a group in Derby. As our group grows, so they're getting more members, which is wonderful that they're getting known in the area. Some members, we have some members who are of colour and from different cultures. What should I be doing as a volunteer to make sure and to make them feel that that this is everybody's group? So what should I be doing as a volunteer for them? Who would like to go first with that question? Got thoughts, Mary? Yeah, go for it. Yeah.
Talk with them. Talk with them, because I don't think I never had any of these sort of services, and I'm sure I would have attended anything. In fact, some time ago, I was attending a voluntary where we went for exercises, and it was everybody and anybody. But what would you do to attract them? No, because we are in UK, aren't we? That's how I see it. So we all belong. But to encourage people to stay and all of that, just listen to them and ask for their needs, and maybe respect their views as well. Direct them to the correct direction. That's how I feel.
Absolutely. Yeah, that's really helpful. Thank you, Mary. And understanding different cultures, maybe bringing that out to the group and enabling people to share about their cultures, and that could be something that is useful for everyone to learn and understand.
Yeah.
And I think that applies. Asking the person and listening to them, it just applies across everything. It's not it's about how people can feel involved and included in the group, whether it's asking them about their culture and background, or what they like for tea, or what biscuits they like. It's making everyone feel like the group is theirs and part of it. And if out of those discussions something comes up that you feel like you want to learn more about or that you want to know about, then Donna's helpful tips of reaching out to organisations that have a bit more knowledge in that area in your local area or nationally. There's lots of things out there. So when you start speaking to these people, it's something else, you know, it might take you on a bit of a journey on things that you want to learn together as a group or as a volunteer.
I would also say as well that we know that people process things in different ways as human beings, not just as stroke survivors, but as human beings. So potentially asking that person maybe privately and then coming back to it when they've had time to think about it, to process it, not put them on the spot, but then also to listen and understand what they're actually asking. And if you don't understand, go back to them and saying, can I just clarify what it is, you know, what you need to be comfortable in this group or to be able to access it? Because a lot of people don't like being put on the spot and would feel pressured. That they might really enjoy the group, but if they're going to get asked questions, maybe they're not going to like to come back. So I think it's a fine line about, giving people the information and then letting them process it in their own way to come back to you. But definitely, to Mary's point, just talk to them, just ask them what they need to make them feel comfortable and check in with them after a few weeks. Are you meeting that need?
Absolutely. Thank you. I hope that helps answer that question for the group in Derby. Great question there. We have an interesting question reflection around supporting stroke survivors who are neurodiverse. So that's a really big term, isn't it, that takes in scope lots of different things. One example in the question is somebody who is an autistic stroke survivor with social anxiety and really wanted peer support, but perhaps struggled to access it due to that anxiety. So being in potentially a big group, people who we don't know, going there for the first time particularly can be quite overwhelming for anybody. So has anyone got any reflections on how to welcome people that have neurodiverse, anxiety or anything like that? Has anyone experienced supporting people into groups in that way? Things that you could do to make the group welcoming?
1-to-1.
Mary, would you like to say?
Has anybody tried 1-to-1? Because it's a good way of, and maybe get the person's permission to add onto it, like 2-3 people. So, but 1-to-1 comes to mind that, contact the person, yes. If the person is trying to reach out and has actually mentioned what they need or their fears are. So just go in gently until you've sort of got their confidence, then ask for their permission to introduce 1 or 2 more people into that little bubble.
That's a really interesting reflection, Mary. Thank you. So almost like a journey into the group. And thinking about what that could look like for somebody. And it may start with a phone call. So a few phone calls before actually coming along to the group to set the scene of what the group is like and to describe it. And then working in smaller groups. It's a lovely idea.
Or it might be that, this has been a big development for us since COVID, that we now have digital groups, because I'm pretty sure we didn't have any prior to COVID. So it is now another option, isn't it? It's now another avenue for people to access peer support on their terms that are comfortable to them. So it might be that they never want to come into a front-facing group, that digital is where they are most comfortable.
And respecting that. Fantastic. Thank you. Well, I think we could sit and have conversations over coffee and lunch, really. It's a huge topic, as you said, Sophie, at the beginning, but we really hope that that this helps plant a seed, or that helps you take something back to your group in terms of a small thing. It doesn't have to be a big thing, does it? It's being on the journey all together. So we really appreciate it. Thank you, Sophie, Donna, and Mary. I'm going to probably close off the session now so that people have time to grab a coffee before the next one.